Hey Supermamas, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Supermama Sunday. And guys, I have been missing y'all. It has been crazy with this surge of COVID. And I have just been extraordinarily busy and I just did not have time to create and film and edit content for y'all. So I have really been missing talking to you guys, but I have got an episode for you guys today, and I'm going to be giving you some important tips, 5 tips about what to do if you get COVID-19 in pregnancy. So these 5 pieces of advice can really help you navigate COVID-19 in pregnancy, and it might even help you survive. So you want to make sure that you keep watching. All right, Supermamas, so let's talk about COVID-19 in pregnancy. And a lot of the things I'm going to share with you are common sense, but when we are pregnant and we're facing a life-threatening illness, sometimes fear can overcome the things that we would normally do if we were thinking clearly, right? So I want to kind of give you these 5 tips, and I want to give you some ideas about things that you should do in the event that you start to develop severe symptoms. Because one thing that I quickly found out during this Delta variant surge is that a lot of times hospitals may not necessarily be prepared to take care of pregnant women with severe illness, because in a lot of intensive care units, they're not used to dealing with pregnant women. So I'm gonna give you some tips today that just might save your life. So make sure you keep watching all the way to the end. So tip number 1, and this is pure common sense, but you would be surprised how many people don't do this. If you find out that you have been potentially exposed to COVID-19, get tested. Please get tested, because a lot of times folks have that fear of getting a positive test, so they'd rather just kind of not know about it. Not knowing in this situation where you're pregnant and you have been exposed to COVID-19 can put you behind the 8 ball, because a lot of times people don't really start to experience severe symptoms until an average of 5 days. So an average person is going to start to get severe symptoms around day 5 or 6. So if you don't even know that you are COVID positive, that means this kind of hits you like bam, like a moving train, right? You gotta wait for the train. Y'all know it's a train that runs outside my office, right? So let's wait for the train to pass so then we can keep talking so you can actually hear. So if you don't get tested and you don't know that you're COVID positive, you get hit bam with severe symptoms, right? But if you know that you're COVID positive, that gives you time to plan ahead and be prepared, because that will give you an opportunity to do tip number 2. Notify your OB and your primary care doctor about the fact that you are COVID positive. And what I do in this situation is I am already planning to do check-ins with my supermamas who have tested positive for COVID. So I know what's going on with them, so that I have given them a prescription for a pulse oximeter. And a pulse oximeter is just that oxygen monitor that goes on your finger that you can do at home, so that you can check and see what your oxygen levels are, particularly if you are having difficulty breathing or you're having really bad coughing spells, any sort of tightness in your chest or shortness of breath. So that pulse oximeter I give ahead of time, even if someone's not having symptoms at all, because you don't know if they're going to develop symptoms on day 3, 4, 5, or 6. So that pulse oximeter is there in the house, because you might wake up in the middle of the night and be like, ooh, my chest suddenly feels tight, or ooh, I just started coughing suddenly. So it's important to have that already in the house. And also you can be prepared with some of the over-the-counter cough and cold medications. Namely, for pregnancy, we're going to want Tylenol or acetaminophen products like Tylenol severe cold and cough or Tylenol cold and flu, so that you have those items already at hand if symptoms start to develop. You can also do like cough drops, throat lozenges, Mucinex, not the Mucinex D. Remember, we talked about that in this video here when we talked about cold and flu treatments that are safe in pregnancy. So you might want to review that video so that you kind of can review the things that are safe to take if you have cough, cold, or congestion. And that's going to be the same thing that you do with COVID-19. Tip number 3, as we have all heard throughout the entire pandemic, is self-quarantine, okay? So this does not mean that we should see you rolling around in Walmart or in the local Publix or whatever grocery store you go to. This means that you should be at home, chilling, minding your business, drinking plenty of water, and taking care of yourself, okay? That you should be sanitizing your surfaces, sanitizing your hands, and staying at least 6 feet away from others, okay? This is very important because you don't want to be passing COVID around to other people. If you know you're COVID positive, it's probably a good idea, again, to reach out to your OB office so that you can set up some appointments. For my team, Team B has been doing virtual visits with all of our COVID positive mamas, and we've been doing those weekly with them just so I can lay my eyes on them and I can see how they're doing. I want to talk to them so that I can hear, make sure they're speaking in complete sentences, make sure I don't hear anybody wheezing and talking like this. And so I need to make sure that they're doing okay. And then we, go over how things are going at home, make sure they're eating and drinking well, not having any of those GI symptoms that COVID-19 can cause, like nausea and vomiting and diarrhea, that I don't need to bring them into the hospital, okay? So, for those mamas who might be higher risk, who have diabetes or high blood pressure, or, who have other medical complications of pregnancy, sometimes I do bring them into the hospital just for fetal monitoring or ultrasound if they need that. So we want, for that first 10 days that you have COVID, we want to make sure that we are talking to you on a regular basis, and many times that is done via a video visit. But please talk to your OB before you just pop up in their office, because there are lots of other pregnant women that are in there, and you don't want to be passing your COVID around to the rest of the mamas. I'm pretty sure they would appreciate you doing your visits virtually until you have been cleared to return back into the office. Number 4, self-care is everything. Take good care of yourselves. If you find that you have COVID, definitely want to do immune boosting self-care. So zinc, vitamin C, elderberry, those are perfectly safe to use in pregnancy. Make sure you're drinking plenty of water and staying well hydrated. So electrolytes are very, very good to have, especially if you've got those COVID GI symptoms that we talked about earlier, like nausea, vomiting, or diarrhea. If you are having, loss of taste or smell, where you really don't feel like eating much, very, very important to try to get your nutrients in, whether that be Boost or Ensure, whatever it is that you can tolerate eating, go ahead and eat that. Gatorade, Powerade, Pedialyte, Body Armor, whatever it is that you want to drink that has some electrolytes and a little bit of sugar, you want to try to get some calories in. If you can have some green smoothies or smoothies that you can tolerate and actually keep down, you want to try to do those things. If you find that you're not tolerating anything, by mouth, like nothing to eat or drink, that is a good reason for you maybe to go in to get some IV fluids, and you should let your OB care team know about that so that they can help you facilitate getting in and getting some IV fluids. Hydration is huge, especially during your pregnancy. And finally, number 5. I want to spend the most time here because this is a big deal. Number 5 is monitoring your symptoms. And for most folks, they're going to have mild to moderate symptoms. And most of these symptoms can be treated from home. But that big symptom that we are always very concerned about is difficulty breathing. And sometimes when folks get COVID pneumonia, they're going to have a lot of trouble breathing. And this usually is going to be brought on by severe coughing spells where they're coughing so much that they can't catch their breath. Or they may have chest tightness so much so that they can't catch their breath. So when I have mamas that are telling me during our video visits, or they're calling in and saying, hey, I'm coughing so bad that I can't catch my breath, or I'm throwing up, or I just have a lot of tightness in my chest, a lot of congestion, I'm not able to breathe well, this is a cause for concern. And that's where that pulse ox reading comes in handy. I need to know that they're keeping that oxygen level above 95%. Now, you might hear about non-pregnant people keeping their pulse ox reading above 93%. Well, for pregnancy, it's a little bit different because there is a gradient in pregnancy, and that gradient is really because the placenta likes to shunt oxygen to the baby. So moms who are pregnant need a little bit higher oxygen level than a non-pregnant person. This is what makes COVID-19 particularly dangerous for pregnant women. And that's why you see in this video, I am urging, begging, pleading with y'all to strongly consider getting vaccinated, because when you are pregnant, your oxygen demands are higher and you need more oxygen. And so getting COVID pneumonia from COVID-19 puts you, mom, at a very high risk for needing ventilator assistance if you develop severe COVID-19. So it is a very serious thing. When you get severe COVID and you are not able to oxygenate your body well, the baby is going to get a good bulk of your oxygen, and you're going to be the one that decompensates. And so what's been happening in hospitals across the country is that babies are getting delivered prematurely, and in order for us to keep the mom from going into respiratory collapse. And then even after the babies are delivered, sometimes we're not able to prevent the mamas from going into respiratory collapse, and they still end up on ventilators. And that's the thing that we just are doing our very best to prevent. And a lot of moms are so afraid of the vaccine, and I get it, believe me, I would be afraid too. But what's even more scary is to think about the fact that you are having a premature baby and you're not even sure if you're going to make it to see this baby grow up. I've seen too many moms who are on ventilators who are not even aware that their baby is in the nursery because they're sedated. So this is not what you want. Anyway, back to what we were talking about. We want our pulse ox reading, or our oxygen level, to stay above 95%. If your pulse ox is below 95%, that is the time to head on to the hospital, and we need to give you some oxygen support, be it face mask or nasal cannula or CPAP or BiPAP machine, so that you can avoid respiratory failure, okay? Respiratory failure in pregnancy looks different than non-pregnant people. And I'm putting this up here on the screen because these are the blood gas readings for a pregnant person versus a non-pregnant person. And the reason I'm sharing this is because sometimes people will draw a blood gas, which is basically a blood draw that we can do to look at the actual blood oxygen levels. So not just the pulse ox reading, but when we draw your blood from an artery, what it should look like. It's very different for pregnant women versus non-pregnant women. And so I'm leaving this up here because you need to screenshot this. People may not know this in emergency rooms or in intensive care units because we think about this differently in the OB world than we do in other medical specialties. So this is very important to know. So, you know, if you go to an emergency room and maybe you're at a hospital that doesn't have an OB ICU or an OB critical care person, this is information that can save your life. A pregnant woman can be in respiratory failure and look normal to someone who doesn't deal a lot with pregnant patients who have high risk problems. So that's something that's very important to note. In addition, we also want to keep in mind that if you have other medical complications of pregnancy like hypertension, diabetes, or you have obesity. These are things that can really lend themselves to you having more severe symptoms. So if you are having shortness of breath, if you're having severe GI symptoms where you're not able to keep down food or water, these are reasons that you might want to consider going in and being seen. And you also want to make sure that you're closely monitored. And I'm just going to be honest with you. Sometimes we got to be prepared to advocate for ourselves. So if you get, to an emergency department, or you get to your OB care team and you're like, hey, and you know that you are not doing well at home and you need some additional monitoring, be willing to say, hey, look, I'm not doing well at home. I've tried this on my own. I've tried all the over-the-counter things. I've tried the medication that you prescribed me, whether it was a steroid pack or a Z-pack or an inhaler, and I'm still not doing well at home. I would like to be admitted for observation. State it out, just like that, and advocate for yourself. So it's very important to watch those symptoms. And we know general symptoms of COVID-19 can be any of these listed here: loss of taste or smell, nausea, vomiting, or diarrhea, cough, cold, sore throat. Headaches are a big symptom. You can have fevers, especially persistent fevers greater than 100.4 degrees. Those are things that can be concerning in pregnancy. Chest pain. And for the pregnant woman, decreased fetal movements. These are things that really would prompt me to have a patient come into the hospital for additional workup and additional monitoring. Doesn't necessarily mean that you have to stay in the hospital, but these are things that we would want to be very cautious about and make sure that everything is okay with you. And of course, I couldn't let this opportunity go without putting in one more plug for you to strongly consider getting vaccinated. And a lot of times when I'm having this conversation with my super mamas here at my office, the thing is that people say, it's experimental. We don't know what the long-term outcomes are. And the truth of the matter is, we don't know the long-term outcomes of COVID yet. We don't. And the other thing that I've been really expressing to moms that I'm working with is that we don't really have any good evidence to support the medications that we're giving to treat COVID pneumonia. There are so many different protocols and treatment algorithms out here. People are doing different things in different hospitals, in different regions of the country. It's really just kind of a like, hey, let's try this. Oh, did y'all try that? Have you done this? It's so experimental out here. The only thing that really has any sort of decent evidence behind it is the vaccine. So I highly recommend that my patients who are pregnant or breastfeeding get vaccinated. I recommend that women who are planning to become pregnant get vaccinated, because vaccination is the only thing that we have right now in the fight against this deadly disease. So I hope that this video was helpful. If you got some good advice from this video, give us a thumbs up and make sure you subscribe so you don't miss a single Super Mama Sunday episode. I'll catch y'all next Sunday, Super Mamas. Peace.